Public Health Worker of the Year, Molly Howell. Molly Howell is the Assistant Director for Disease Control at the North Dakota Department of Health. She also serves as the Deputy State Epidemiologist and Immunization Director. Molly has not only been a driving force behind COVID-19 vaccine planning operations, but also for the state of North Dakota's entire response to COVID-19.
Molly has been our shining light throughout the COVID response. She is dependable, reliable, truthful, encouraging, all those things that are what we like to see in a leader and are valuable and helpful in how we do our work.
Molly has worked in the Division of Immunizations at the department for over 15 years. During her tenure, she has led the division through many administrations, immunization schedules, legislative sessions, vaccine preventable disease outbreaks, and 2 pandemics. She has remained a steadfast and reliable advocate for immunizations and has worked tirelessly to ensure that all North Dakotans have access to life-saving vaccines.
She's very humble, she's self-effacing, she's not one to bring attention to herself, very modest, but that's probably one of her best qualities. She's just such a hard worker, not looking for attention, always just looking for the next best way to improve the health of North Dakotans.
When the COVID-19 pandemic hit, Molly was in charge of keeping the Division of Disease Control operating, while the director was stationed in the State Emergency Operations Center. She worked closely with other section heads to get the state's case investigations and contact tracing efforts going. She led the department in the development of policies, directing the program, and starting up the investigation process. Soon, COVID-19 vaccine planning became Molly's main focus. Because of North Dakota's outstanding immunization program, we were one of 6 programs selected by the CDC as a COVID-19 vaccine planning site. North Dakota was the first state the CDC visited, and they used their lessons learned and information gathered to inform the rest of their COVID vaccine planning visits.
Molly possesses strong communication, collaboration, and organizational skills, which have produced innovative solutions for vaccine distribution and administration. As a result, COVID-19 shots are getting into the arms of North Dakotans faster here than anywhere else in the nation, with almost zero waste.
Molly has held many leadership positions, such as serving on the National Vaccine Advisory Committee, being past chair for the Association of Immunization Managers, and serving as liaison to the Advisory Committee to Immunization Practices. Molly has a strong work ethic, listens to concerns, and builds up others to become better leaders.
I just want to start off by thanking the North Dakota Public Health Association for this award. This past year has definitely been challenging for public health, to say the least, but I continue to be amazed at what public health can do when we set our mind to something and work together. I feel a bit awkward accepting this award for Public Health Worker of the Year because I know firsthand how hard all of us have worked over the past year and continue to work, especially in responding to COVID-19. I do want to say very special thank yous to everyone at the North Dakota Department of Health. The vast majority of employees stepped up to assist in responding to the pandemic, even though it wasn't necessarily their day job to work in infectious disease. I'm especially grateful to the other staff in disease control and our leadership who really worked tirelessly to conduct case investigations and contact tracing and doing data analysis and providing education, all to try and prevent the spread of COVID-19 over the past year. I don't just consider you coworkers, but we're also friends and family. I also have to say thank you to NDSU's Center for Immunization Research and Education, who, whether they liked it or not, became honorary members of disease control and really played a key role in responding to this pandemic and helping implement COVID vaccination. And then to the Department of Health immunization team, especially, you all continue to amaze me with your passion for immunizations and dedication to making sure North Dakotans are protected, not just against COVID-19, but also all vaccine preventable diseases. And really the reason why COVID vaccination and the immunization division is successful is because of your work and everything that you do. In thinking about the past year, I think the impact of COVID-19 will probably change public health forever, but I do think it will be for the better. We have definitely strengthened our partnership and hopefully shown the public in the state of North Dakota the critical role that public health does play in everyone's lives. And I just look forward to this pandemic being over and all of us being able to get together in person and celebrate all the achievements that we've had over the past year.